What's up, losers? What's up? What's up? What's up? Hey, today is Friday. I think today's Friday. Pretty sure today's Friday. But today is Friday. So shout out to all y'all that are out here. Boy, look, hey, why do I look like that? I'm looking like I'm aging, like not well, and I'm not liking that. You know what I'm saying? Your boy a little tired, trying to get some stuff tanker, you know what I'm saying? But hey, you already know what the deal is. Today is Friday. We're going to be doing NCLEX questions. We do these every Monday, Wednesday, Friday at 5:30. Well, until at least I get tired of them and y'all don't want me to do them anymore. And if y'all don't want me to do no questions no more, y'all let me know. What's up? What's up, Kate? Kate, you already know what the deal is. Hey, if you guys are new here, welcome. Hey, I require 10,000 likes. I require 1,000 likes and 100 people in here before we get started. So play with me if you want to. And if I don't get those two things, we ain't going nowhere. I will boycott this Friday and I will go do something else. I took my NCLEX this morning. Camille, that's what I'm talking about. So you already know on Monday, we're going to know what's up. So, hey, if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. Make sure you like, share, and follow. That's the trifecta that TikTok needs in order for this to get out. So, stop being selfish your whole life. Stop being selfish. It says picked up on the truck today. Okay, all right. Rashida says, Kevin, I passed my NCLEX. Yes, Lord. That's what I'm talking. Oh, wait, we got 2 people? So Rashida. Oh, whoa, hold on. We got 3. Nathan passed and Bombshell passed. Yes, Lord. That's what I'm talking about. 3 people in a row that passed NCLEX. So shout out to all 3 of y'all. I need all of y'all to give them love. All 3 of them right now. All 3 of them. Bombshell, Nathan, Rashida, I need for y'all to just give them love right now. Lauren passed with 85. That's what I'm talking about. Lauren, do your thing. Hey, y'all need to give all. We got 4 people and we ain't even been in here 2 minutes. 4 people. I need for y'all to give them all the love and all the support. Welcome to the greatest shit show on earth known as nursing. To all 4 of you. That's the most I've had that ever popped in at once that told me that. So congratulations to y'all. If y'all could give one piece of advice to everybody here that is trying to conquer the exam and that's trying to get onto that next step, what would it be? So shout out to y'all. Hey, we're at 101 people. Y'all not gonna sit here and listen to me run my mouth. Well, yeah, you are, but you're just not gonna see me while we go through these questions. Ladies and gentlemen, we're about to go through questions Monday, Wednesday, Friday, 5:30. We do these questions or until I get tired. So here we go. Y'all give them some tips. Take it on Tuesday. Hey, give them tips. Here we go, ladies and gentlemen. Question number 1. The client with varicella will most likely have an order for which of the following categories of medications: antibiotics, antipyretics, antivirals, or anticoagulants? What are we thinking? By the way, I got these questions off nurseslabs.com. No part of me cares if you think these questions are easy or not. Just answer them. Just answer questions. If you're new here, I want to know who you are, where you're from, and where you are at in your nursing journey. And if you're not a nurse, what are you doing here hanging out with us? Oh, and another thing, everybody's in a different stage in their nursing career, whether you're starting it or whether you've been a nurse for 40 years. No part of me cares about either one of those. However, you got to be able to meet people where they are. So don't come in here and don't be rude to people that if they potentially get the answer wrong. This is all about getting into a rhythm as well as understanding how you can study for these exams, okay? I'm going to give you guys, oh man, I didn't put a timer up. We got C. Whoop. Hold on. Everybody's telling me C. I need to put a stopwatch over here. Stopwatch. There we go. All right, y'all, here we go. Here's our answer. It says, I love listening. It's a great refresher. Teresa, I'm glad that you love it. Here we go. And the course, and I can't say of course, but the answer is C. It is antivirals. Varicella is chickenpox. This herpes virus is treated with antiviral medications. In adults, infection tends to be more severe. And treatment with antiviral drugs such as acyclovir and valacyclovir is advised if they can be started within 24 to 48 hours of rash onset. That is part of physiological adaptation, which is the 3rd largest section on the NCLEX exam at 11 to 17%. All right. It says, understand the test taking strategies and watch keywords. Y'all can pass. That's what I'm talking about. Appreciate you, Nathan. Appreciate you, ladies and gentlemen. Hey, we had 4 people that came in here at the same time and told me that they passed NCLEX. So they're giving y'all some good words of wisdom. So make sure you guys pay attention to that. All right. Here we go. Question number 2. The client is admitted complaining of chest pain. Which of the following drug orders should the nurse question? Is it A, nitroglycerin, B, ampicillin, C, propanolol, or D, verapamil? What are we thinking? Lex is screaming A. Lex, you don't got to scream at me. I got you. I've been an RN for 2 years. I love the refresher. You guys can do this Don't overthink it. There you go, Corey. Appreciate you. Shout out to all 186 of you guys. Hey, we got these questions off nurseslabs.com. Nurseslabs.com. They're free sets of questions. You guys can go over there and check them out for yourself. And if you're new here, make sure you guys keep smashing the like button. You guys share and you guys follow. Savage Mom says, I didn't RTFQ. Look at you. See what happens when you don't RTFQ? Here we go, y'all. Here's our answer. Here's our answer in 3, 2. And the answer is A, ampicillin. Oh, I'm sorry, it's B, ampicillin. My bad. Obviously, I can't read, but it's definitely B, ampicillin, right? There is no indication for an antibiotic such as ampicillin. Penicillins have been very effective against Staph aureus in the past. However, Staph aureus has been capable of exhibiting resistance against them by producing a penicillin hydrolysin enzyme, right? So that is part of safety and infection control. Sorry, y'all, I can't read today. I don't know what's going on with me, but hey, y'all are going to live through it just like me. Safety and infection control, 6 to 12% on the NCLEX. Smaller section, but very, very much important. Very much important. So make sure you guys understand where these questions are falling under. All right. Somebody says, passed my NCLEX last week. These lives were so helpful. Thank you. L. Hey, somebody passed last week. I don't think you came in here and told us last week. Congratulations to you, L. Everybody give L the love and all the support. Appreciate you for being here. Welcome to the greatest shit show on earth that is of being a nurse, whether you are an RN and LPN. Don't disrespect the LPNs because I'll check you. Trust and believe me, I will. All right. So if you could give one little piece of advice, what would that be? Here we go. Question number 3. Which of the following instructions should be included in the teaching for a client with rheumatoid arthritis? Is it avoid exercise because it fatigues the joints? Take prescribed anti-inflammatory medications with meals, alternate hot and cold packs for 2 affected joints, or avoid weight-bearing activities. What are we thinking? Going to give my NCLEX, going to take your NCLEX, please? All right, I'm assuming that's what you meant. Is it all the love? It says all the love to RNZ. There you go. Shout out to you, L. Here we go. What are we thinking, y'all? Hey, quick little thing about me, since you guys are telling me about yourself. I've been a nurse for 3.5 years. I've worked ICU, specifically in a burn ICU and a medical ICU, as well as floated to neuro and did some med surge. I've worked in PACU as well as I've worked in the OR. So it's just a little bit about me. I want to know about you. So make sure you guys drop them down in the comments. All right, here we go. Here's our answer. Here is our answer in 3, 2. And the answer is B, take prescribed anti-inflammatory medications with meals. Anti-inflammatory drugs should be taken with meals to avoid stomach upset. Disease-modifying or anti-rheumatic drugs are initiated as soon as the diagnosis of rheumatoid arthritis is made. That is part of the health promotions and maintenance, which is 6 to 12% on the NCLEX exam. Once, of course, it's another smaller section on the NCLEX. However, still very much important because there are 8 sections, and that is on the lower end of the 8 sections. So shout out to everybody that got that question right. Hey, by the way, we're on the road to 10,000 likes. If I don't have 10,000 likes by the time I get to question 10, I promise you, I will Martin Luther King this whole live. And by that, I mean boycott. So don't be out here acting up. OK, I'm just letting y'all know. Question number 4, a client with acute pancreatitis is experiencing severe abdominal pain. Which of the following orders should be questioned by the nurse? All right. Is it meperidine, 100 milligrams IM Q4 hours PRN for pain? Mylanta, 30 cc's Q4 hours via NG tube? Is it, cimetidine, 300 milligrams PO QID? Or is it morphine, 8 milligrams IM Q4 hours PRN for pain? Which one should the nurse question? Meaning something's wrong. This thing don't belong here, right? What are we thinking? Let's see. We got Angie. I see you out there answering. I see you. I see you, Angie. What are we thinking, y'all? I'll give you guys 10 more seconds. Waiting on your NCLEX results. All right. Is it Litzy? Litzy? Hey, when you get those results, let us know what's up. Let us know what's up. All right, y'all. Here we go. Here's our answer. Here is our answer in 3, 2. And the answer is D. It's morphine, 8 milligrams IM Q4 hours PRN for pain. Morphine is contraindicated in clients with gallbladder disease and pancreatitis because morphine causes spasms on the sphincter of Oddi or Oddi, however you want to say it. Gastrointestinal obstruction is another important contraindication. It is also considered by many as contraindication to provide opioids to individuals that have a history of substance misuse, especially if a patient has had a history of abusing opioids. That is part of safety and infection control. Safety and infection control, which is 6 to 12% on the NCLEX, smaller section, but still very, very much important. Remember, you need content, Q&A, and you need rationales. You need the content because you need the knowledge. You need the Q&A because you got to apply the knowledge. You need the rationale so you can retain all of the knowledge. Does that make sense? Stop playing games with me. Make sure y'all like, share, and follow. All right. Here we go. Question number 5. The client is admitted to the chemical dependence unit with an order for continuous observation. The nurse is aware that the doctor has ordered continuous observation because hallucinogenic drugs create both stimulant and depressant effects, induce a state of altered perception, produce severe respiratory depression, or induce rapid physical dependence. What are we thinking? Becky says, hold up. Becky says, I passed my NCLEX. Hey, you already know what to do. Hey, that's number 5. Becky, you're number 5 to come in here to tell me that you passed your NCLEX. Congratulations. Welcome to the greatest shit show on earth known as nursing. I need everybody. Hey, you already know what to do. Y'all give her all the love. Give her all the love right now. And Becky, if you could give people if you give somebody some advice in regards to the NCLEX, how to study for it or one little piece, what would it be? Well, once again, congratulations to you for wrecking shop and, conquering that NCLEX. All right, y'all. Here we go. Here's our answer. Here is our answer in 3, 2. And the answer is B. It's a hallucinogenic drugs induce a state of altered perception. Hallucination drugs can cause hallucinations. Go figure. Continuous observation is ordered to prevent the client from harming himself during withdrawals. Adverse effects are extremely subjective with significant variability and unpredictability. One patient may experience a positive effect filled with bright hallucinations, sights, and sensations, increased awareness owing to mind expansion, and marked euphoria. The positive spectrum of effects was colloquially called a good trip. That is part of psychosocial integrity. Smaller section on the NCLEX, 6 to 12%, right? But psychosocial integrity, all right? Smaller section on the NCLEX or for the client needs. Make sure, hey, RTFQ, you better read the fucking question. I'm just letting y'all know. Hey, if you don't like the F word, you're going to have a hard time being a nurse. I'm just letting y'all know that right now. Hey, that doesn't mean that we're not professional because we make it happen around here. Ladies and gentlemen, I had 5 people come in here and tell me that they conquered the NCLEX. Could have been for this. Who knows? But hey, free sets of testing tips over there for you guys to conquer the NCLEX. It's a free download of bootnurse.com/test, or you guys can check it out in my bio. Go over there and check it out. Go get it for free. Stop playing games with me. Here we go. Question number 6. A patient arrives at the emergency department complaining of mid-sternal chest pain. Paint the picture. What disease process talks about that sign and symptom? All right, which of the following nursing actions should take priority? A complete history with emphasis on preceding events, an electrocardiogram, careful assessment of vital signs, or chest exam with auscultation. Abdullah, I didn't ask you if it was easy. I asked you to answer the question. I'm pretty sure I tell you that every time you come in here. So I didn't ask you if it was easy. Just answer the question. It may be easy for you, but it's not easy for other people. And if it was easy, this question would get 100% correct. And everybody answers differently. If you're doubting yourself on select all that apply, don't pick it. There you go. If you don't know, don't pick it. Pick the one that you are sure of. 100%. There we go. Yeah, Abdullah, I remember you. Don't make me ban you. Don't make me do it. All right. I didn't ask you if it was easy. I may be old, but I ain't that fucking old. Here we go. Here's our answer. Sandy says, I would say C. All right, Sandy. Cool. Please forget. All right, Abdullah, you good. Here we go. Here's our answer in 3, 2. And the answer is C, careful assessment of vital signs. The priority nursing action for a client arriving to the emergency department in distress is always an assessment of vital signs. This indicates the extent of the physical compromise and provide a baseline by which to plan further assessment and treatment. Monitor vital signs every 5 minutes during the initial anginal attack. Right, blood pressure may indicate or may initially rise because of sympathetic stimulation, then fall if cardiac output is compromised. Tachycardia also develops in response to sympathetic stimulation and may be sustained as a compensatory response if cardiac output falls. That is part of physiological adaptation, which is the third largest section. Somebody said needs telly. Yeah, for sure. Right. But hey, they're in the ED, right? So, hey, you got to get those baseline vital signs though, before I try to do anything. Physiological adaptation, third largest section on the NCLEX at 11 to 17%. 11 to 17%. Hey, it's part of the big three. You got management of care, pharmacology, and physiological adaptation that make up the three largest section on the NCLEX exam. Somebody says, where's the doc? The doc wasn't the answer, but I got you. The doctor better be in there. Here we go. Question number 7. A patient has been hospitalized with pneumonia and is about to be discharged. A nurse provides discharge instructions to a patient and his family. Which misunderstanding by the family indicates the need for more detailed information? So apparently the family's not getting it. What did they say? For us to just be like, nope, that's not what I said, and I need to reiterate on the instructions. Is it A, the patient may resume normal home activities as tolerated, but should avoid physical exertion and get adequate rest? The patient should resume a normal diet with emphasis on nutritious, healthy foods. The patient may discontinue the prescribed course of oral antibiotics once the symptoms have been completely resolved? Or is it D, the patient should continue use of the incentive spirometer to keep airways open and free of secretions? What are we thinking? We got a bunch of people saying C. Got 8 people, 9 people. 9 people. Okay, so I got a bunch of people saying C. Appreciate everybody. Wait, it says, why did somebody, Abdullah, you already know why I quit the ICU. I've made like 7 videos of why I quit the ICU. You know the good thing about myself? I don't like repeating myself. So I'm just saying. All right, here we go. Ladies and gentlemen, I got these questions off nurseslabs.com. Nurseslabs.com, free sets of questions. You guys can go over there and check them out for yourself. Also, if you're new here, I want to know who you are, where you're from, and where you're at in your nursing journey. My adopted mom is in here. I love you. Thank you for coming in here and being awesome. Love Nurses Labs. Heather, Nurses Labs is fire. I like it. London says, okay. Wisconsin, shout out to Wisconsin. I know some folks up there. And the answer is C. The patient may discontinue the course of oral antibiotics once the symptoms have been completely resolved. It is always critical that patients being discharged from the hospital take prescribed medications as instructed. Just like somebody said, antibiotic resistance, right? In the case of antibiotics, a full course must be completed even after symptoms have resolved to prevent incomplete eradication of the organism and recurrence of infection. Take antibiotics exactly as directed. Do not stop taking the medication just because you are feeling better, because you're about to get all sticky and icky. There you go. The client needs to take the full course of the antibiotics as part of health promotions and maintenance, 6 to 12% on the NCLEX exam. Alyssa says, I'm in the Caribbean. Shout out to you. Are you from the Caribbean or are you down there vacating? All right. Here we go. Shout out to Tallahassee. I've been there maybe once or twice. I've been there maybe once or twice. Shout out to Texas. I live in Texas, specifically in San Antonio. So shout out to all y'all that are rocking with me. Question number 8. The nurse is caring for an elderly Vietnamese patient in the terminal stages of lung cancer. Many family members are in the room around the clock performing unusual rituals and bringing ethnic foods. Unusual is probably not a word that I would use, but just be aware. Which of the following actions should the nurse take? Restrict visiting hours and ask the family to limit visitors to 2 at a time. Notify visitors with a sign on the door that the patient is limited to clear fluids only with no solid food allowed. If possible, keep the other bed in the room unassigned to provide privacy and comfort to the family. Or is it D, contact the physician to report the unusual rituals and activities? What are we thinking? Everybody saying C. We got some people that's saying A. Hey, if you guys are new here, welcome. We're doing NCLEX questions. Hey, something else about me. I failed my NCLEX 3 times, y'all. I failed my NCLEX 3 times. And not one part of me cares about what any of y'all think about that. You want to know why? It's because that exam doesn't determine what type of nurse that you're going to be. None of y'all would have known that are new here at all, unless I opened my mouth and told y'all, because that test doesn't determine the type of nurse that you are. So I'm going to need for you to get out of your own way. I'm going to need for you to get out of your own head. And I'm going to need for you to stop listening to these people that don't know anything that go on with your life. Especially everybody got an opinion about everybody else's life, but don't know how to fix their own fucking life. You see what I'm saying? So I need for y'all to get out there, get out of your own way, You know what I'm saying? Put the fucking work in, get this license, go out here and take care of these folks and make this money, baby. But the answer is C. If possible, keep the other bed in the room unassigned to provide privacy and comfort to the family. Okay, hey, if y'all are new here, yeah, hey, y'all better ask somebody. I don't play games about me and mine. And by me and mine, I mean all 400 plus of y'all in here rocking with me. You know what I'm saying? Won't like no hospital. You said, hold on. I actually says, really? I'm sure the hospital admins won't like that. No one fucking cares about a hospital admin. And I'm telling you right now, a hospital admin don't give a shit either as long as you have a license. Trust and believe me when I tell you that. Gabrielle, what's up, girl? I see you. But when a family member is dying, it is most helpful for nursing staff to provide a cultural sensitive environment to the degree possible within the hospital routine. In the Vietnamese culture, it is important that the dying be surrounded by loved ones and not left alone. Traditional rituals and foods are thought to ease the transition to the next life. When possible, allowing the family privacy for this traditional behavior is best for them and the patient. That is part of management of care. Management of care, which is the largest section on the NCLEX exam at 18 to 23%. Cultural competency. There you go. It's a very, very big deal. Like here in San Antonio, it's a large Hispanic culture, as well as we have a large Indian and Middle Eastern culture as well, depending on what side of town you actually live on. So hold on one second, because now I'm annoyed. Hold on. All right, there we go. Hey, Abdullah's gone. So that shit's annoying. You know what I'm saying? So, hey, when I try to tell y'all, stop fucking playing with me, stop playing with me, bro. Like, for real. But hey, you come in here and you act up, you getting banned too. Trust and believe me. Here we go. Question number 9. People tested me today. Woo, yes, Lord. The charge nurse on the cardiac unit is planning assignment for the day. All right, which of the following is the most appropriate assignment for the float nurse that has been reassigned from labor and delivery? And is it A 1 week post-operative coronary bypass patient who is being evaluated for placement of a pacemaker prior to discharge? Is it a suspected myocardial infarction patient on telemetry just admitted from the ED and scheduled for an angiogram, a patient with unstable angina being closely monitored for pain and medication titration? Or is it D, a post-operative valve replacement patient who was recently admitted to the unit because all surgical beds were filled? What are we thinking? Shout out to all 442 of y'all out here rocking with me. We're doing NCLEX questions. Make sure you guys like, share, and follow. Hey, we're on the road to 20,000 likes. 20,000 likes. I don't know what we're doing, but I need carpal tunnel. I need all of y'all to get carpal tunnel. And then when you go to the doctor, tell them it was because of me. They'll understand. They will understand. Somebody saying most stable. Cool. Awesome. Hey, so if you guys are new here, welcome. I want to know who you are, where you're from, and where you were at in your nursing journey. And if you're not a nurse, what you doing here hanging out with us? What are you doing hanging out with us? Remember, how do we treat float nurses that go to a new floor? How do we treat floating nurses that go to a new floor? Right? Just like you would treat any new grad. In reality, right? Bedside education. Okay. All right, y'all, here we go. Here's our answer. Here is our answer in 3, 2, third-year nursing student from the Philippines. Shout out to the Philippines. Canada. Hold on. Somebody just told me they passed their NCLEX. Jay says, I just wanted to pass my NCLEX. Thank you for the help. Oh, you just wanted to say you passed your NCLEX. Awesome. Hey, everybody, right now, Jay, I need for y'all to give Jay all the love and support. Congratulations, Jay. Jay Nicole, welcome to the greatest shit show on earth, known as being a nurse. Welcome. Julia, my other half. Julia, where were you when I needed to ban somebody? What's up with that? But welcome to the greatest shit show on earth, Jay. If you have one little piece of advice, what would you give to everybody that is trying to accomplish the goal? Who is it? Herlene says, I passed my NCLEX. Shout out to you, girl. That's what I'm talking. Hey, that's like, you're like number 8. You're like number 8. Congratulations on passing the NCLEX. Congratulations to all of you. Show them that love. Welcome to the greatest shit show on earth. One little piece of advice you could give everybody. All right. So, and the answer is a 1 week post-operative coronary bypass patient who is being evaluated for placement of a pacemaker prior to discharge. That patient is the most stable, as you guys were correct when saying. All right. The charge nurse planning assignment must consider the skills of the staff and the needs of the patient. The labor and delivery nurse who is not experienced with the needs of cardiac patients should be assigned to those with the least acute needs. The patient who is 1 week post-operative and nearing discharge is likely to require routine care that is part of management of care. management of care, which is the largest section on the NCLEX exam at 18 to 23%, ladies and gentlemen, 18 to 23%. So shout out to all y'all that got that question right. Remember, if it's an LPN, if it's a new grad, if it's an LPN, if it's a new grad, or if it's a nurse that's being floated to a new floor, they get stable patients. All right. Always remember that. Question number 10, a newly diagnosed 8-year-old with type 1 diabetes and his mother are receiving diabetes education prior to discharge. The physician has prescribed glucagon for emergency use. The mother asks the purpose of the medication, which of the following statements by the nurse is correct. Glucagon enhances the effect of insulin in case the blood sugar remains high 1 hour after injection. It treats hypoglycemia resulting from insulin overdose. Treats, was it a lipoatrophy from insulin injections, or it prolongs the effect of insulin, allowing fewer injections. What are we thinking? Shout out to all 450 of y'all out here rocking with me. Hey, I want to know who you are, where you're from, where you're at in your nursing journey. Oh, Nurse Tibby's in here. Ma'am, I appreciate what is that? Is that a gummy bear or a high bear? Well, shout out to you. I appreciate it. What are we thinking, y'all? 10 more seconds. 10 more seconds. We're on the road to 20,000 likes. Shout out to Jamaica. Shout out to Jamaica. I ain't never been there, but I'm going to go there one day. Shout out to Cali. I've been to Cali. I lived in California. Duval County. I lived in Florida. You know what I'm saying? Shout out to the Philippines. Miss Dialysis Nurse. I see you. Dallas. Hey, Keith Lee coming to Dallas. Hey, don't y'all mess that up. Shout out to the Louisiana, Georgia. Well, Atlanta done already messed that up. So, hey. From Ghana. Okay, we got people all over the place. Williamsburg, VA, H-Town. I see you. Is it Lolly? I see you, dialysis tech over there. And the answer is B. Glucagon treats hypoglycemia resulting from insulin overdose. Glucagon is given to treat insulin overdose in an unresponsive patient. Patients with decreased level of consciousness cannot safely consume oral carbohydrates needed to raise their blood sugar without risk of aspiration, and obtaining IV access can be problematic in the diabetic population, which can prevent prompt administration of IV glucose. That is health promotions and maintenance, which is 6 to 12% on the NCLEX exam. So shout out to everybody that got that one right. Hey, everything goes in a loop. If you don't understand it, guess where you got to go? Back to content.